The American Heart Association is a non-profitable nationwide organization but has several divisions located across the country. For relevance for the community, the nearest division would be Los Angeles County. Since the LA division differs in many aspects such as socioeconomic status, race, gender, and environment, they focus on a more specific population, problem, and use Healthy People 2020 to highlight their goal, which is to improve the CVD health of all Americans by 20% and to reduce deaths from cardiovascular diseases and strokes by 20%. The LA County Division focuses on a population of communities, families, and women. These populations have experienced lack of access to healthy foods, obese, have an unhealthy diet, have high sugar and diabetes, have hypertension, lack exercise, and more. And these are all risk factors of heart diseases and strokes, as seen in this chart. And this is important because this could lead to even death. So, to fully understand who the American Heart Association of LA is, the focus will be what type of organization they are, the background of the American Heart Association, and also who is involved. So, the American Heart Association was founded in 1924 by six cardiologists, and it has grown into the nation's oldest and largest voluntary organization dedicated to fighting heart disease and stroke since then. And also, it's a non-profitable organization, as mentioned before, that's profited by private contributions and also researchers who look to the American Heart Association to fund their advancements. The American Heart Association of LA is to be a relentless force for a world of longer, healthier lives, but also certainly to building healthier lives free of heart disease and stroke. And these are supported by sponsors such as USC, UCLA, Children's Hospital, and all these sponsors help to fund programs or events such as the Los Angeles Heart and Stroke Ball, STEM Goes Red, Pasadena Heart Walk. And all these events are for the public to help avoid risk factors and teach them how to live a healthier life. Here's a short clip on the Pasadena Heart Walk or Community Steps that's a similar program to it.
Community steps were founded on the premise that if we can bring people together, there's dialogue, and people can get to know each other, it'll change hearts and it'll change minds. And we're already starting to see that. Being able to come together in a non-emergency contact situation, our sole purpose here at Community Steps is to bring unity into the community. And today is just the beginning. We're going to be walking in the park every Saturday. 2 Saturdays a month, there's going to be themed activities where they'll be walking with the officers and also workshops, things around healthy eating, active living. We're going to do things around jobs, CPR training. We've got blood pressure, cholesterol, BMI screenings. We've got DPSSs out here. People want to get CalFresh, SNAP benefits. The LA County Mobile Library is out here with over 2,000 titles. We've got ADAP, Covered California. Learn more about health insurance options. So many things right here in the community.
So not only do they have events, but they do also have education programs, which are CPR training, information on healthy diets, and information on exercises. And these two are funded by the sponsors. And there's also help from 33 million volunteers and 3,400 employees who create these programs for the public. The most important one that's really highlighted is the CPR program. And the goal is by 2020 to train 20 million people in the life-saving skills of CPR, and eventually doubled the rate of bystander CPR from 31 to 62%. Last year, the amount equaled to 50,275, and this year so far it is 6,769, and that's only 3 months into the year. Now, the AHA of LA lives on 6 principles, in which basically explains how all residents must have quality health care, and then also that the incentives should be built into the healthcare system to promote appropriate preventive health strategies. All residents of the United States should receive affordable, high-quality healthcare, and then race and gender and geographic disparities in healthcare must be eliminated. And the most important one is that the United States healthcare workforce should continue to grow and diversify through a sustained and substantial national commitment to medical education and clinical training. So all these principles underline a common theme to where all people should gain access to quality healthcare no matter what the background is. So this organization is very diversified when it comes to people, and it doesn't just focus on one ethnicity or race. Here are the board members who to contact in the Los Angeles AHA office for all the events that happen in the AHA, and these are all the people.